So as more panelists arrive, we'll make way with introductions, but I'll go ahead and get started. I'm Spencer Gurley. I'm host for this room. As we're getting started, for those of you that are new to Clubhouse, here are a couple pointers. You can use the share button at the bottom, the one that looks like the arrows going into each other, to share this room on social media or directly with others. If you're inviting others, you can narrow the search by using words like sickle cell or health equity. We'd also highly encourage everyone to click the share on Clubhouse option, as it will kind of increase the likelihood that individuals on the app are able to find this room, and will generate traction and kind of hopefully get some extra people into the audience. Also, feel free to check out other people's bios, especially our panelists, and be sure to follow all of our moderators, panelists, and co-hosts. We highly encourage everyone to raise their digital hand if they have a question or want to be let up on the stage. For those of you that don't know Consuli, broadly, Consuli is a public benefit company with a mission to enable individuals to participate in the data economy. Experts suggest our individual data is worth about $20,000 per year. We do this by operating a marketplace for members where we become their agent and assemble patients' health records, labs, prescriptions, wearables, quality of life surveys, etc. Importantly, members receive smart matched individualized offers from us for opportunities, including to participate in clinical trials and data trials. There's no cost for anyone to join our movement, and you can learn more at consuli.net. Importantly, there's a research study for sickle cell patients pinned at the top of this room. Consuli is pleased to share that it is teaming up with Sanguine Biosciences and Pfizer to support an independent research study for patients living with sickle cell disease. If you or a loved one have been diagnosed with sickle cell disease and are over 18, live in the US, and you qualify, you can contribute directly to sickle cell disease research from home and be paid up to $1,300. It's now my pleasure to turn the floor over to our room moderator, Elizabeth Dreicer, who is a philanthropist, activist, and co-founder and CEO of Consuli. Elizabeth will be introducing our distinguished panelists and guests. Elizabeth, now over to you.
Thanks so much, Spencer, and thanks for you and Glynis for making this event possible. And our panelists, welcome. We're honored to be able to host and facilitate this room. We do aim for the room to be interactive. Just FYI, for those that have tried to invite others, I noticed that Clubhouse is glitching out if you try to invite based on the old way, which is to like narrow your audience to sickle cell or equity or whatever. I've gotten booted out 2 or 3 times already. So just giving everybody a fair warning. It seems as though we're working with a little bit less than what we would have expected in terms of technology. So we'll just endeavor to do the best we can. Seems as though the only thing we can do is really share it on Clubhouse generally, not to our specific audiences. At any rate, I also want to just encourage folks to participate in the chat. I am curious whether the chat is working. Maybe somebody can test that, because that was another thing that I noticed was not really facilitated. Oh, look, it seems like somebody did. Yep, testing the. Thank you very much for testing that. Fabulous. Whoops, can you guys hear me?
Yes, we can hear you.
Okay, great. Thanks. I got a notice that I had low bandwidth. All right. So, and then just, raise your digital hand. We'll endeavor to get everyone that wants to participate to the stage to engage in this important discussion. And then a couple of other quick things. There will be a virtual public whiteboard established to capture the core nuggets from this discussion and to hold and bridge the issues on behalf of the many organizations and many advocates and patients that are participating in this and future discussions. Now, as I introduce our panelists and guests, I'd also like to just set the table by asking each to, in their opening remarks, share what they perceive are the core needs of the sickle cell community at this particular moment in history. So with all of that, it is now my pleasure to first introduce, and I'll do my best here on names, folks, Lupe Afolabi. Hopefully I got that right. Lupe is a Nigerian woman in Oakland, California. She became a nurse to give patients someone they could relate to beyond a textbook. She started the nonprofit I Fight for Sickle Cell to spread awareness, support sickle cell warriors, and empower individuals to be conscious of their hemoglobin genotype. Lupe, it is my pleasure to turn the mic over to you for your opening remarks, including touching on the core needs of the sickle cell community at this time. This is Elizabeth, and I'm done speaking for now.
Hey, can you guys hear me?
Yes, we can.
Okay, thank you for introducing me, Elizabeth. Hey, everybody. Welcome to the conversation. Definitely excited to see what we all have to say today, and really appreciate the fact that sickle cell is making its way into various spaces and becoming a conversation more often.
Thanks so much. Lupe, in terms of just what you're seeing right now, what are the most pressing issues or core needs that you see at this moment in history? Just love to have everybody opine a little bit just to provide some food for fodder here.
In regards to sickle cell, right?
Indeed.
I think it's always going to be the aspect of a lack of education on the disease amongst medical professionals in places where we need them the most, like the emergency room, for example. And that lack of an education trickles down into us not having the support we need to continue to have, like, different cures for us or different support systems for us and things of that sort. And then that lack of education also trickles down into us facing a lot of mistreatment and racism due to ignorance towards the disease.
I really appreciate you raising that issue. Yeah, you're basically speaking to the misdiagnoses, which I know has come up a number of times. And, and we think about, what is it going to take to get the providers to recognize this, on contact. So really important. And we'll dig into that and look at, modern ways that might start to, manifest even in, some of the clinical decision support systems that are in emergency rooms. Great. Appreciate that. Next up, I know Michelle will be joining us shortly, but I'm going to next move to Ufoma Muwen, and hopefully I did somewhat justice to your name. You'll have to probably restate that for us. At 23 years old, Ufoma has lived with sickle cell disease and now lives sickle cell free after undergoing a bone marrow transplant in late 2016. She currently has devoted much of her time outside of academics to pursuing her passion for building community. She is the founder and CEO of Not Just You, a nonprofit sickle cell support organization that is devoted to creating a support system for individuals and families affected by sickle cell anemia disease. Ufoma, I am turning it over to you for your opening remarks and touching on your perspective of the core needs of the sickle cell community, again, at this moment in time. This is Elizabeth, and I'm done speaking for now.
Hi, thank you all so much for having me here. You did a great job at pronouncing my name. You can also call me Foma for short, just like I've got in my nickname. But yeah, I think probably if what the sickle cell community needs right now, I'd probably say is more funding in like various areas across the spectrum. So funding and research, I think sickle cell, as much as sometimes it feels like it because I'm like I do research on sickle cell disease that like I'm surrounded by it, but in the grand scheme of things, I think it's a really underfunded and under-researched area. There are so many facets of sickle cell that have not been studied, like sickle cell and nutrition, sickle cell disease, and like the use of, I know there are some more recent studies coming out of the UK very soon, or sickle cell and like the need for like a service dog or a service animal and whatnot. So I think research is a really, really important place where funding could be. And then also funding for like just like help resources, in the sense that I think sickle cell disease, again, back to research, there's not a lot of funding in like sickle cell disease and mental health. And I think that there is a lack of funding to provide mental health services for sickle cell patients, as well as even just like, I know personally from when I was doing my transplant, I felt like my family and I did not have the adequate resources to be able to even sacrifice the time that we did to go for transplant and like sustain the rest of like my two siblings, and my mom's the only provider, and there were no resources. The union was not willing to help my mom. So just things like that. I think resources is a really, really big thing. Monetary, of course, but in other ways as well. I know I kind of rambled, but yeah.
Thank you so much. I appreciate those opening remarks, and I want to come back to you on the cure that you were able to get, and that impact, and what percentage of the sickle cell community could benefit from that, and what's holding that back. So I have a lot for you. We'll get to that in a moment. But thank you so much. And FOMA, do you prefer FOMA?
That works, actually.
Well, tell us what you prefer. If you would prefer Euphoma, just tell me how to pronounce it so I can do you justice.
You could go with Euphoma.
Euphoma. Okay, perfect.
Yeah.
I'll definitely do that. Thanks so much. Appreciate that. Okay, so next up, I'd like to introduce Brenda Green. Brenda is a married mother of 3 from Columbia, South Carolina. She's an engineer by profession, but is a founder and CEO of a nonprofit, the Be Strong Group, by purpose. She founded the nonprofit in honor of her son, Braden, who has sickle cell disease. And the Be Strong Group's mission is to spread awareness of sickle cell disease through education, advocacy, and empowerment. Brenda, we're so glad to have you. I'm turning the mic over to you for your opening remarks, including what you perceive are the core needs at this moment in history relative to sickle cell disease and what's needed in the community. This is Elizabeth, and I'm done speaking for now.
Thank you, Elizabeth. Thank you, Spencer. I am honored to be in this conversation and with my fellow panelists. And I think the first 2 speakers mentioned what I had written down were the core needs, education and funding. And I would like to stress education, and that's one of the main things our nonprofit centers our programming around, is educating our community. I knew very little upon when my son was diagnosed. I wasn't aware of my status or my husband's status. So that's one of the things we actually push, is educating our community. Our community has employers, fellow coworkers, teachers, doctors, nurses. And so I think the more our community learn and know about sickle cell disease, it can definitely impact the lives of those who are impacted by sickle cell disease. And of course, you can't say too much about funding, but yeah, those are the 2 core needs I think that's required at this point in time. Thank you.
Thank you so much. And we'll dig into the education piece in broad brushstrokes and detail also as we get into the dialogue. I know that is a core miss still. And it's sort of, all these years later, it reminds me of some of the other, educational gaps between what, some know and the rest know, and how do we really overcome that in a way that is supportive. Next up, Kehinde, Salami. Hopefully I got that close. Kehinde is a sickle cell patient and award-winning advocate and founder of the Sicklekan Sickle Cell Foundation. Kehinde, I'm turning the mic over to you for your opening remarks, and also if you could touch on the core needs of the sickle cell community from your perspective at this moment in time. This is Elizabeth, and I'm done speaking for now.
Thank you, Elizabeth. I just want to say thank you guys for having me. I'm actually from the UK, so it's quite late here. Basically, I honestly think that one of the most important things is actually encouraging healthy conversation within our own communities, because one thing about sickle cell is that there's often stigma within the Black and Caribbean community in regards to talking about and also awareness about having a condition. Like, for example, I was born with sickle cell disease, but I didn't know I had it until I was like in my early 20s, 22, 23. That's when I found out I had sickle cell. And it's mainly due to the fact that my parents didn't have that conversation with me out of stigma and fear of sickle cell holding me back. And I feel as if this is part of the reason why most sickle cell warriors, especially men within our communities, don't talk about the condition and don't actually want to. It's a case where they don't feel as if they need to burden their families because of the whole stigma of being black and having to be strong, and having to just get on with things. And I feel as if one of the main issues here is that we don't talk about within ourselves. And then for us to even get to the funding and then to get into the mainstream, we need to have the conversations within ourselves first and foremost, because we can't wish for a better future with sickle cell if we're not having those conversations. And that's why I feel as if, we need to start branching out, having conversations in schools, colleges, workplaces, and make sure that it's often something that's not a burden where we have to remain silent. And I feel as if it's something that it's one of my mottos, as in break the silence, speak up, Sicklekan, because I feel as if we're beyond just suffering in silence now. It's a case where we need to now speak up with our voices, with our chest, and also demand the change that we need. And we can only do that by just advocate for ourselves foremost, and to educate amongst ourselves, and then we can branch on to the mainstream society. So that's one of my main advocacy points, is just making sure that we encourage the conversation.
Thank you so much. And I want to give Raquel, thanks for being with us. I know I don't have your exact bio, so I'm going to ask you to introduce yourself and also your perspective on what you think are the core needs of the community at this moment in time. Raquel, the mic is yours.
Oh, thank you. Thank you, everyone, again for having me. So my name is Raquel. I am a bioethics, biomedical science doctor. I just completed that program last year. So my focus has been on clinical research. I also have joined Harvard Medical School, and I'm at this present moment, my last semester, completing clinical research as a global clinical research, developing clinical trials, and my focus is rare disease. One of my special areas that I really enjoy is genomic medicine. So the focus was genomic epidemiology. I really believe that genetics plays a part in all diseases. And I really believe that genomic medicine should be introduced into sickle cell. We have so many other means of servicing and helping individuals who are who have been diagnosed with sickle cell. They can be treated with things such as CRISPR. CRISPR is one way that we are, they are looking at as ways to change the look of the how blood is structured, so to speak. I might be saying it wrong at this moment because I don't have it in front of me. I wish I did. But, and you can probably look it up yourself. CRISPR and sickle cell is one way that they are now beginning to see good results to treat patients who do have sickle cell. So I think genomic medicine should be really introduced into treating patients opposed to just traditional medicine. And of course, I believe that we have to educate people in general, and it's not just the patients, it's the physicians as well, because there are some things that you can do in medicine that you can pinpoint early before it starts to become a problem, such as reviewing the EMR systems, looking at the patient's overall, demographics. We collect demographics for a reason, and we put that information into the system, but somehow we don't have the people who are really looking at the demographics in a way that we can actually see and pinpoint the root cause of things that are happening to a patient, such as excruciating pain. People have pain like this a lot of times, and they really truly don't understand why that is. But there's a reason for that, and a lot of times people find out when it's too late, which is a problem. And I don't think in this, 2022, you should have to find out late in life that you have such a rare disease, such as sickle cell. So that's my stance on it. Thank you.
Thank you so much, Raquel. I really appreciate that perspective. And that really dovetails very nicely into a couple of themes that have emerged in this dialogue. The theme around the diagnoses, which you're really speaking to, sort of the how are we harvesting these clear symptoms to arrive at, some probable diagnoses without, folks having to wait, decades, frankly, to get the answer. And given the data sets that exist already in the electronic medical records, I think you're sort of positing, hey, why are we not correlating these very obvious symptoms to at least elevate that particular diagnosis question and subsequently test? So I'd love to hear, sort of on the diagnosis side, the different perspectives of what we think is emerging as solutions to that the misdiagnoses, and where the kind of the rose and the thorn, where are we making progress and where are we really just still stuck. And I'd love to just ask the panelists, just come off mute, and anybody in the audience too, this is just a reminder, if you've just joined us, please feel free to raise your digital hand. We'll try and get everybody that wants to participate in this discussion and that has personal lived experience or is involved in any way to the stage. So without further ado, maybe I'll go around and see, does anybody want to come off mute anyone want to go first, or you want me to call on you? Let's see here. Okay. Lupe, do you want to kick that off?
I'll go second.
Okay, no worries. Does anybody want to go first? Well, maybe I'll ask, specifically, I know we heard from some folks who indicated that they got diagnosed late in life. Kehinde, do you want to speak to that? I know you're in a different, you're in the UK, nice medical system, if you will, but curious. I know you talked a little bit about the cultural barriers to discerning, but the issue about diagnosis and the presumably in an environment where you've got a universal healthcare system, why do you think it took until your 20s for the medical community, forget your family or your community, why didn't the medical community pick it up?
You know what? I think I've got a unique case because I was born in Nigeria, so it was a case where
Okay.
I was born in a different country, and then I was brought to the UK when I was about 5 years old. So and I wasn't hardly ever in hospital. So it wasn't a case where I would have to be in hospital. I think my symptoms with sickle cell were not serious enough where I was in that hospital. Even though I can recall where I was sick and I had sickle cell issue, it wasn't serious enough for me to be in hospital where they checked me. So it was a case of I only found out myself when I basically went to the hospital, because it was a case where I was in so much pain. I was waking up trying to get to university and I couldn't move, so I had to go to hospital, and that's when I got diagnosed it. And then it was a case where having that conversation with my family, I found out that my little sister has also had sickle cell. So I feel as if when it comes to diagnosis, I feel as if I have a very unique way in regards to I was diagnosed. But for me, I think in regards to how it's diagnosed in the UK in general, I do believe as if we do have a very good medical system where if two parents have sickle cell trait, the baby gets screened at birth. And there was a case where, for example, my daughter and the mother of my children, she has sickle cell trait and I have full blown sickle cell disease. So it was a conversation that we had before she was born that there was a high possibility that she could have sickle cell. Same thing with my son. There was a high possibility that he could have sickle cell. So basically they got tested at birth to see whether they had sickle cell. My son carries the trait, but my daughter has sickle cell, unfortunately. But it's a case where we was able to give the treatment straight from birth. So I do believe that within the UK, we have a great medical system where those at high risk of having sickle disease, they're screened first, and if they do have sickle cell, they got the best available service to treat them if they need to be treated, basically.
Thanks so much for that. It's great to hear that there's more preemptive diagnosis occurring in this next generation, and so I'd like to turn it to Lupe. Same question. What do we think the issues are around diagnosis? Rose in the thorn. The mic's yours.
I honestly can't say. I feel like it's a lot better now in regards to the US. I know, like, I'm a 90s baby, and I believe beforehand they weren't really screening like they do now. But these days, a lot of hospitals screen, like if you're an African American um, baby, you're screened automatically for the sickle cell trait or disease. And lately, they've been doing testing for parents that are African American. So when you do like all of your prenatal testing, they'll check to see if you and the father of the child are carriers. So for me, I was diagnosed, I believe my mom said I was diagnosed at birth, and I had my first crisis at 3. So I kind of knew the hospital early on.
Got it. Okay, thank you. It's good to hear the different perspectives. Just continuing around, Eufoma, your perspective on the missing diagnosis paradigm.
I don't have too much to speak on. Like for me, I was diagnosed at age 2, and my mom actually had known that she had sickle cell trait. And my mom actually had a sister who passed away when they were rather young from sickle cell disease. However, my dad did not know. And I believe there was a time where they had a conversation about it, like, hey, like you should probably find out if you have sickle cell disease or if you have sickle cell trait. And I think this was either when my mom was like pregnant or like when I had just been born. And I think my dad was like, really reluctant to it due to like the stigma associated with it, especially back home in Nigeria. So essentially, I guess there was one doctor's appointment they had went to, and I wasn't feeling very well, and that's when they found out that I had sickle cell. And so I'm not sure if you can hear me. Can you guys hear me?
Yes, I can hear you.
Okay, perfect. Sorry, I was getting a call. Yeah, and so I think that in terms of like here in Canada, I believe they actually do have like newborn screening now that they've been really trying to implement. I think specifically in Alberta, I remember Alberta Health Services had put out a press release about newborn screening for sickle cell. So I think it's something that is in the works. However, I think beyond, like, even before diagnosis, I think or before like birth and diagnosis, because I think the screening for diagnosis for sickle cell disease is usually around age 2 for most children, because that's when the fetal hemoglobin decreases, if I recall correctly. I could be wrong. Maybe Raquel could probably correct me on that. But I'd say that now that there's newborn screening, that's great. But I think even earlier is, especially during like while the mother is pregnant and when families are family planning, I would really love to see more initiative from the healthcare system to get especially like planning parents, or when mothers come in for their routinely visits, for more an emphasis on screening then, just because like Fortunately, there are just so many babies continuously being born with sickle cell disease without the knowing of like the parents and stuff like that. And, you know, I always say that I'm really fortunate to have had a successful transplant and a successful ride with various treatments, but I know that's not the same story for a lot of people with sickle cell disease. So, like ignorantly you know, going into relationships not knowing what your trait status is, and then family planning, I think it can be really dangerous because we're all not privileged to healthcare like here in Canada or in the UK. And I know there's still chances in America, but I know that my transplant, I think the cost was like 500, like $1,000, something outrageous like that, that normal people don't have access to. So I would really, really, really like to see more initiative on the parental side before the baby is born.
Fama, thank you very much for that. And you're touching on sort of the cure component here as well, which we'll come back to. Just to round out the diagnosis, I want to get Brenda and Raquel's point of view on this. Brenda, do you want to go first?
Oh, absolutely. Well, as was mentioned here in the U.S., I think the majority of, well, all 50 states were doing the newborn screening for sickle cell disease and the trait around the late 80s, early 90s. So my son was diagnosed at birth, but unfortunately, I wasn't aware of my husband's trait status, and I actually have hemoglobin C. So that's another piece that we're pushing, is knowing your actual status for those of us who don't know. Or even when during the newborn screening, you know, when families are notified that their child may have the trait, um, kind of emphasizing the importance of knowing about, you know, complications that can occur with having the trait, even if rare, but to at least educating the parent on knowing and being able to then educate or tell their child once they get of age of their status, so they can be aware and be able to make informed decisions. So, you know, when it came to us, we were fortunate that we were able to find out about our son within a couple of months. And the only reason why I was delayed that long is because they had the wrong pediatrician listed on his records. But we found out pretty quickly, so he could go ahead and start seeing his specialist. Thank you.
Thank you so much, Brenda. And Raquel, I'm going to turn the mic to you on why are we
Hi.
missing diagnoses?
Well, I believe there is a, to be perfectly honest, I believe that people are just not, you know, in the medical profession, we're not following protocols. And somehow, like here in, I live here, I'm in New York. It's just, we have so many patients here, and, you know, one doctor he may see 100 patients in one day. And I think it can be overwhelming for them in their defense, but it should not be a defense. And at times, you know, they drop the ball in many cases. I too had a situation. My son has sickle cell trait, and we didn't find that out until he had cancer. He wound up with cancer, so that's how we found out. And we're all now just seeking, you know, doctor visits with, you know, a blood specialist. So it took us to our adulthood to find all of this out. Something that probably should have been, you know, noticed a long time ago. So the question is, are we really looking at the blood work? You know, doctors are always asking for blood work, but who who gets to watch, observe the blood work when it comes back? Who's actually looking at it to see what it says? I know now we do genetic testing for babies. I think someone mentioned that earlier. You know, the parents, before, you know, the babies arrive, and we can pinpoint that at that moment. And to be honest, I don't think that's 100% either. I just think that sometimes a lot of things are just, unnoticed until something else happens, and that's what we are going through right now. We're one of those wait and see mode. Maybe it's not that bad, or a lot of times when I speak to physicians about uh, certain studies, blood work on patients, and I asked them, I said, well, isn't that alarming if if something is off? Yes, but it could be one number or it's one or two numbers. So if it's a one or two numbers, sometimes they don't look at it as something in emergency. In my eyes, I look at it and I say, well, once it's one number off, whether up or down, that's a problem for me. But not everyone sees it that way. So I think it has a lot to do with, the physician, and management, again, the EMR systems, so many things that are in place. Before we had everything was paper, so and they realized, okay, we missed a lot of things. We missed a lot of information because we did not have the EMR systems at one time. So everything was documented, and a lot of times we didn't understand physicians, their penmanship, because they write sloppy and this and that and the other. But now we have the EMR system. The problem with the EMR system is that not everyone updates the system accordingly. So now that's another issue. So you may get one physician who puts everything in, and then you may have someone else that just maybe jot a line, and that's it. So I think it's a combination of things. Thank you.
Yeah, Raquel, thank you so much. I appreciate you. And just for the audience that may not know, EMR is electronic medical record, just so we keep it totally understandable for everybody and that aren't in the health realm. And also, I just am curious from your perspective, Raquel, and I'm not sure if you're seeing this, whether or not there are any, automated analytics flags that are starting to be added to EMRs. I mean, one of the big problems, as you were raising, is that, you may have a patient that has multiple symptoms over different periods of time, and together that symptomology would be indicative of sickle cell, let's say. But in a singular appointment, perhaps it doesn't all click, right? So the system is keeping track, even, with the imperfection of humans. Curious whether you're seeing any development around flagging for that. I know, a lot of EMRs, they flag for sepsis and, things that are really difficult to see in one setting, but, the totality of the medical record can kind of tell you a diagnosis. I'm wondering what you're seeing on that front.
Well, I believe you can diagnose from an EMR system. You can what we call integrating medicine. So we're able to look at the what the physician is saying versus looking at all of the data that's incorporated into the EMR system for that patient, and you're able to diagnose them. That was the reason, I believe, why they created it, other than just having pen to a paper, but more so to actually look at the big picture of what's going on with a particular patient. Are they red flagging them? Yes, they are. Some places they do red flag them. Yes, we do red flag them, but that's not everyone. And I guess that should be the goal, to try to get more people on top of these things, because the EMR system is supposed to work better. It should be working better. There's so much you can do from an EMR system to treat patients, that we should have less problems opposed to more. What we have today, I think we have more problems with when it comes to medicine, when it should be much better.
Thank you so much for that. And I appreciate us, diving into this missing diagnosis question, because it's really the other side of the education, right? And there's the patient awareness and the community, and then there's the practice of medicine. So there's two sides of this coin. I am curious whether or not when patients suspect that they may have sickle cell. I'm wondering, what the medical community response is and how readily the testing is done, or whether there's, friction in that realm, if anybody knows or can speak to that, or if it's just simply the gap or, not thinking about this diagnosis. And I want to turn, if anybody wants to take themselves off mute and address that, if you know, and then we'll be moving on to the next part, which is, research and cures and how are we going to get to a better state and quality of life. Does anybody want to flash their mic at me and tell me? Oh, Io, yes. I'm sorry. I'm not sure your name. Eric.
Yeah. Hi.
Eric, the mic is yours.
Awesome. Yeah. So I myself have some, I guess, genetic factors for sickle cell, and after my cancer surgery, there was a lot of things that I was obviously anxious about and wanting to make sure that I can reduce my risk of other diseases and so on. I wanted to make sure whether this was something that was manifest or whether it was just a potential risk. And so here in Canada, at the very least, it was very difficult to get a general practitioner to refer me to a specialist who would then do the testing. So it was actually easier to get an internal medicine specialist to order the test. But even then, the question of, well, what is a technical diagnosis of sickle cell? How many of the cells have to have this loon-like shape for it to qualify as sickle cell? So if I have some occasional pain in my arm, is that the sickle cell or is that something else? And being able to differentiate that proved actually very, very difficult. And so I ended up doing the test 2 or 3 times at different labs just to make sure that it wasn't. And so that was something that was a little bit frustrating, because for me, as a scientist who also is a biotech startup entrepreneur, I wanted to see the data, and that was unavailable. I wanted to see kind of the microscope pictures of the cells or whatnot, the method that they use to make this diagnosis, just out of curiosity. So the method was kind of shrouded in mystery to me, and it created a lot of unnecessary anxiety in addition to already being in that situation. So having a very good care team was very critical and very important. And unfortunately, due to a confluence of random events, I ended up not only losing my family doctor, but because he retired, but also the replacement doctor for him ended up moving back to England. So it ended up proving to be very difficult. But there are genetic markers that you can use to kind of realize your risk, but whether or not it manifests is another thing. So it kind of one of the things that they say often in genetics is, I have a genetic factor that makes me likely to pass away in my childhood. Well, if I'm an adult now, that means the statistics, the Bayesian interpretation of the raw genetic data makes it difficult to make any sort of definitive claim. And in fact, other factors, not only the genes, but the microRNA themselves tend to regulate some of these systems. So to get a very extensive or very precise diagnosis may prove to be a difficult, especially depending on where you are. If you find yourself in the United States, it may be cost prohibitive because of insurance. In Canada, may be an extended wait time. So it's often important to get on top of these things, but also realize that the anxiety that comes along with seeing your own genome has to be balanced with, hey, it's complicated, and take a moment and perhaps try to seek out I think they're called a genetic counselor. And having gone to Human Longevity in San Diego, California, I found that to actually be very helpful, although that was a private service, something on the order of $5,000 to $10,000. So,
indeed, I know exactly where you're referring to, Eric, and that is definitely outside the scope of what most people can access. I want to turn us to and folks, as we get to the next topic. I'd like to just, if you have anything to add to this last conversation, please feel free to just tack it on. And also, I just want to acknowledge, thanks, Spencer. He's pinned to the top of the board the CRISPR link that was referenced earlier by Raquel. So Raquel, hopefully that's the study you were referring to from Scientific America. So let's move to the next
Thank
question,
you.
which is, oh, you're welcome, of course, and really thanks to Spencer for finding that. The next question is really around, cure. So we've got somebody on the panel who is sickle cell free at this point, which interestingly enough, Eric, you're raising the point of what's the ratio, the propensity of these sickle cells that make somebody free versus in a disease state. Eufoma, I know you raised the point, very expensive, difficult to access, but life-changing. And so curious about what other cures folks are seeing on the horizon. What's the percentage of the population that are living with this disease that this type of a treatment would be effective? That's sort of question number one. And then, where is the state of research relative to cures? What's in the way? So just a free for all, lots of opportunity, lots of surface area for you guys to all opine on. I'd love to go around the table here virtually. And just a reminder for those in the audience, please feel free to raise your digital hand. We'll gladly welcome you to the dialogue. Okay, so maybe I'll just, I'll start with you. Eufoma, do you want to first weigh in, and then we'll just work our way back up the panel?
Sure. I've just actually got to head out after. I've got a meeting with a group for school. But yeah, I think that like the bone marrow transplant for sickle cell disease, it's honestly a great treatment. And like when gone smoothly, it really has been life-changing for me. I think at the time when I had done it, I was like, I had to go under the pediatric ward. I had just turned 18, but we had to like talk to the board and whatnot because they were only doing it for kids in Canada at the time. So now there's been a few adults who have gone through the process, but again, like not only is it like, there's a like it's an expensive process that many people around the world do not have access to, but then when you eventually do get the opportunity to go through it, there's the whole trying to find that 100% match or the best possible match. For myself, I had a sibling donor, so my youngest sister was 100% match, which was amazing. And I've even heard of in certain cases where two parents have donated to a child. But I do know that like there's more possibility for complications, and really and truly there's so much on the line when you're in that state of transplant, when you're completely immunocompromised, and like really and truly anything can go wrong. And at the time when I did my transplant, there wasn't that much research on the specific one that I had because it was a reduced intensity bone marrow transplant, so it was a little bit newer at the time. So I think that now there's a lot more research, but again, I think its availability is really, really low. It's not the most viable option for most people. So as blessed as I am, like I really do recognize that I think there should be more accessible treatments for individuals all over the world at different socioeconomic statuses. So yeah.
Thanks so much. Appreciate that. And Lupe, I want to give you an opportunity to weigh in here on both the treatments that you're seeing on the horizon. Also, what research is standing in our way. Lupe, the mic's yours.
For me, like in regards to like the different treatments that are coming up, my only issue is sometimes they're not the most convenient for us. Is this okay? Sorry, give me 1 second.
Sure. Luke, we can come back to you too. Maybe I'll go to the next person on the panel. Raquel, do you want to weigh in here? What's the state of research, treatments? Where are we in this development?
Well, one of the things I spoke about earlier which was CRISPR. I haven't delved deep into it the way that I I would like to. I plan on doing so, but I think that CRISPR has some great results that from just the little bit of information that I did read about, and I think other people, since Eric placed that information up here, it will be a good opportunity for them to read into it because um, CRISPR is something that is being used a lot today. Although there are a lot of ethical issues behind it, but for something such as like sickle cell, I think that could be, a great potential if it, if you look into it. I think you just need to look into it. I know I plan on doing some more research on it. I do a lot of different research on various rare diseases, and sickle cell was one of mine because, like I explained earlier, my son does have the trait. All of us, they see something. We don't have necessarily the trait, but uh, my mother, these are things that I'm just finding out not too long ago. It's been a while for my son, but now we have been noticing lately that we have some issues when it comes to, our the blood. So now we are now being seen by specialists, just to make sure, because there's some kind of other rare diseases coming from that, and not too sure. So it's a lot of questions, and how come this is not coming up? This should have come up a long time ago. You're talking about my parents who are, in their mid 80s. So, so if we see it that far, in that far gone in the 80s, my parents, then, clearly we have to look now for all of our children and grandchildren in the future. From what was said to me is that everyone, all of my siblings, all of us have to be looked at now. So it's just pretty interesting to, I'm lost for words because it's like I'm just finding out more and more and more, every day about this. But symptoms for me, I see a lot of different symptoms from when I hear like my mother says she can't walk, or my sister speaks about her arm, like Eric spoke about earlier today. And it makes us wonder, okay, well, is there something else going on? As far as sickle cell, is there another form out here that we don't know about? A friend of mine, a daughter, he lost a daughter from sickle cell. They didn't know she had sickle cell, and she wound up with a very rare kidney cancer that was connected to the sickle cell. So it's so much behind it that I think it does warrant a lot more research, and we're not doing enough. I don't think we're doing enough about it.
So I'm curious, thank you, Raquel. I appreciate that perspective. I'd like to turn it to Brenda, then Kehinde, then Eric to weigh in on the same question. Oh, Lupe, I see you just flashed. Sorry. Are you ready? We'll come back to you. I'd love to get your perspective.
Go Sorry about that. I was helping my mom last minute.
No worries.
But yeah, I just wanted to add on, like, in regards to the therapies and the treatments that are coming up. I really love the fact that there are different things that we're able to access now. The only thing is that it seems like a majority of them are an inconvenience to us, which pretty much sucks. Like, ideally, if we had like the perfect treatment or the perfect care, it wouldn't take so much of our like time or our day, or like interrupt our lives in a significant way. And it seems like a majority of them do. Like, for example, like the bone marrow, the stem cell transplants, like those are intense treatments, to get a cure, and they're not always guaranteed. And then you risk, like, the possibility of being infertile and things like that. Or like how there's what is it called? It's like a dectia. I don't know if I say it right. But like, for example, like that's something that's kind of newer that can help. But that's like an infusion where you have to go in and you have to take time of your day to do. So I love the fact that we're having a lot of new things being discovered and used. I just my hope is that we develop more things that are not such an inconvenience to the sickle cell community.
Yeah, appreciate that. And for those that are coming next and others that have already spoken, I'm curious as to, what the impediments are in the research realm. We're hearing some things, but, the difficulty of getting different processes and therapies studied is certainly one of the things that we're hearing. So I'd love to hear folks touch on that. Brenda, I'm going to turn the mic to you, then to Kehinde, and then to Eric. Brenda, the mic's yours.
Thank you. And I'm speaking from an advocate position, a mother of a sickle cell warrior. And I know one of the first questions I had when my son was seeing his hematologist is, how can we cure him? And that was coming from just a parent. And at that time, of course, this was 15 years ago. So there were less uh, treatments and therapies, and the research wasn't then as it is now. And at that point, his hematologist told me that the available potential cure for him, he was not a candidate for it because of the associated risk of how dangerous it would be. So the risk of him pretty much dying from that potential cure was greater than how he was handling sickle cell disease at that time. But today I'm very encouraged. I'm encouraged by the additional means of treatment, therapies, medications that were mentioned, while there are more trials for potential cures, especially along the gene therapy line. And I do, just from basic listening to people speak, I understand they're searching for a type of cure that's safer for more people. And so that's what I'm encouraged by. I'm also encouraged by the number of people, of warriors who are actually participating in the trials. And that's an important piece of finding a cure as well, is having participants in these trials. Thank you.
Yeah, I really appreciate that, Brenda. And just as a reminder, there is a landscape study looking at the various treatments and how patients are tolerating those treatments. It's pinned to the top for those that are interested in participating. It's designed, it's a at-home trial. Basically, it's a blood draw at the beginning, at the end, and just journaling. So for those that are living with sickle cell or loved ones, just take a look. It's certainly something that we want to highlight and support where possible. Kehinde, may I turn the mic to you, and then Eric will come back to you.
Right. I actually think of this from two different points of view, because I do feel as if I'm encouraged by the number of treatments available now. Just things going through clinical trials, the breakthroughs in certain treatments, but I'm still not happy with the progress over the years. Like, for example, sickle cell has been well known for over 400 years now. And within the medical community, I think about mainstream medical community, about 150 years now. And we've had little to no progress in regards to treatment through that span of time. So compared to other conditions, I do feel as if, we're disproportionately not getting the funding, not getting the breakthroughs compared to other diseases, and I feel as if it can only be because of one reason. I'm not gonna bring up, but the reason why. So I'm encouraged now the fact that there are different treatments available, because before it was mainly treatments were blood transfusions just to get you by, and then if you were really really sick, you would have to have a bone marrow transplant. But we know the dangers of having a bone marrow transplant, and the fact that it's mainly done in children, not in adults, due to the low survival rates in adults. So while I'm happy with the fact that we have new treatments and cures are coming through the pipelines now, the rate of it is, to me, it's not proportionate to other conditions that are affecting the wider community, and that's why I'm vastly disappointed in that aspect. But in regards to what Tolulope was saying before, there is a drug that's being used, like that was prescribed to my daughter, that's actually keeping her healthy, and it's a drug that was prescribed to me that I decided wasn't beneficial. It's called hydroxyurea. And the funny thing about hydroxyurea is that it was primarily a cancer drug that's, by accident, they tested on sickle cell and they found that it was very effective for patients with sickle cell disease. So I just feel as if, the rate in regards to us getting medical progress in regards to treatments and cure is very slow. And I feel as if, we need more pressure, we need more lobbying, we need more funding, we need to up the rate, because I feel as if in order to give the next generation of sickle cell warriors, like my daughter, for example, a better chance of survival in regards to having the best lifestyle ever, we need a constant and faster rate in regards to pushing out these cures and treatments. But however, I don't want it for the sake of it being rushed. I want to know 10 years down the line what are the side effects of these certain treatments. And I feel as if when we don't know that, like for example, I think a few years ago there was a treatment where they wanted to give us the an edited HIV gene to cure sickle cell, but we didn't know, what's the side effects 10 years down the line, and I feel as if there needs to be extensive medical research, but also we need to know the side effects to certain treatments, and often we're not being told these side effects. Where we're often being told one version of the story, where these are the new treatments, this is a breakthrough for sickle cell, but however there hasn't been extensive studies to say 10 years down the line, there's no side effects, or these are the potential side effects. We're not getting that side of the story. And I don't think it's balanced in that aspect. I don't know how it is in America, but I just feel as if there needs to be a steadier progress when it comes to bringing out these cures. And also, we need extensive study in regards to what are the side effects of these cures. And that's something that we're not getting priority in regards to that aspect. But on the microscope, I'm happy. I'm happy that the fact that there's the CRISPR treatment. I'm a bit concerned in regards to the cancer link here, because I'm very reserved when it comes to rushing into new things, because I want to know the longevity of these treatments, and I feel as if because some of these treatments are very, very new, we don't know 10 years, 20 years down the line the effects that it would have on us, and I'm very cautious in that aspect. And it's just, I don't know. For me personally, I have mixed feelings. I'm happy, but I'm also not satisfied with the rate in regards to how sickle cell's been treated, viewed by the medical community, and how it seems as if sickle cell is always the last resort, the last condition to get these breakthroughs, to get the funding, to get the research, to get these clinical trials underway. And that's kind of makes me a bit sad in that aspect, if you get what I'm saying.
Absolutely, and I appreciate you raising that. And it's an important that's an important perspective, and certainly something that we want to highlight here. And I think we have to just sort of speak the truth into what's occurring. Eric, I want to give you an opportunity to weigh in on this particular thread as well. Where are we with research? What are the impediments? Where are we on the cures, treatments, etc.? So your perspective.
Sure. Yeah. So one of the things that I've recently come across is, hey, CRISPR-Cas9. Sometimes it's kind of like playing Russian roulette. You want to trade sickle cell for cancer. Some people, that might happen. How can we minimize that risk, or are there alternatives? In fact, there is some evidence to suggest that this other kind of DNA, not the mRNA, but microRNA, which are little snippets, maybe 20 to 50 nucleotides long, and they actually regulate the expression of some of these genes. So it may be better not to replace the gene, but to not express it, so therefore turn it off. And so that's an alternative to this sickle cell, because you change a few letters here, and in the grand scheme of things, because of the complexity of the system, it could develop into something a little bit more problematic. And in fact, the sickle cell CRISPR-Cas9 clinical trial was stopped as a result of that, because a certain proportion of people started developing cancers. Now, whether or not that happens for everybody, that's really hard to predict. And that's kind of where I say the hesitation is really a balance of the quality of life. If your quality of life is really impeded by something like this, then perhaps you would want to opt in for a clinical trial. I personally went in for a clinical trial for my chemotherapy, and it helped me survive a cancer that my father did not survive because the therapy didn't exist during his time. So it's really a personal journey that you have to go through, and making sure that you speak with the appropriate individuals and see if, hey, look, this clinical trial, and by the way, it's clinicaltrials.gov, where you can see if you want to shop around, as it were, and see if any of these trials you could qualify for. Sometimes, given the amount of information that is released each day, and it's over 1,000 publications in medicine per day. So to expect our physicians, our doctors, to do it all alone when they have other patients, we kind of have to meet them halfway there. So for us to do as much work as we can, and they say, Dr. Google, ha ha ha, don't be Dr. Google. Well, if you're diligent and you're careful and you make sure that you just, hey, look, I found this clinical trial, I found this paper, here, doc, I'm going to give them to you. You tell me if it's applicable to me or what you think I should do. And if you don't like what your doctor said, do what they say in medicine, seek a second opinion, or second, third, fourth, fifth, or in my case, it was the seventh doctor that I saw finally took my cancer seriously. So don't give up, but try to be diligent. If symptoms don't go away within a month, go to the ER. That's at least the advice that I would give people in Canada, because that kind of accelerates the escalation of this issue. So sometimes there are little hacks in the system that are not well known, but should be more well known for the rest of us. Thanks.
Thanks, Eric. I appreciate that perspective, and it's good to get just a global. I know each country has a slightly different experience set, but certainly appreciate you sharing. I do want to acknowledge I think we have Ila Bapa. I do want to introduce him. He's joined our panel. I know you weren't able to join it right at the beginning, but just briefly, I'll share a little bit about his background. He's a brand strategist and entrepreneur. He's also a sickle cell advocate for the Safia Sickle Cell Foundation, a foundation dedicated to creating awareness on sickle cell disorder and providing support to individuals living with sickle cell disease. Eli, you're finding us sort of at the, we've gone around the bend, as you can imagine, in this conversation, talking about everything from, the persistent misdiagnosis to different curative, treatments, to the missing and languished research in this realm, to funding issues. And I'm sure I'm not doing justice, but I'm just giving you the topography of what we've been chewing on here in service of trying to advance this work and to stitch people together that are working in different places. So I'm going to turn the mic to you to give your introductory remarks, kind of what you think the state of play is, what's needed right now from your perspective. And then we'll come back to gathering other input from our panel. And just a reminder to our audience, you can raise your digital hand. We'll do our best to welcome you to the stage. And then also just to speak to something that Eric was just speaking to, there's a study, it's a landscape study. This isn't, there's no, new treatment, but it is evaluating the various treatment options that are out there. It's pinned to the top of the room. If you have sickle cell or somebody's living with sickle cell over 18 in the US, please feel free to fill out that survey. And if you qualify, we'll definitely have folks connect with you. Just a reminder that Consuli actually does take the clinicaltrials.gov data. And if you become a member, we do all that work of connecting you when you fit a particular study. So just takes a little bit of the hard work out. All right, Ila, the mic is yours. Over to you. Okay, we almost made it the whole meeting without saying you're on mute. I think we did pretty good. Okay, well, I think you're still on mute, so we'll come back to you as soon as I see you come off of mute. All right. So I want to give, I know we've had a lot of dialogue among the panel. Do we have anybody else who, oh, I see that, Spencer, do we have anybody else to raise to the stage?
Not at
Just
this
waiting.
moment.
Okay, got it. All right, so if anybody wants to come to the stage, this is the last call for that. All right, maybe we'll just go around the room and, just sort of a lightning round of thoughts as we're wrapping this particular session up. Obviously, we didn't solve things, but we've exposited a bunch. So, might I turn it first to Kehinde? Your thoughts as we're departing here.
Oh, my thoughts are, I feel as if, I'm encouraged by this conversation, and also, expanding the whole, there's very different aspects about sickle cell that needs discussing, and I'm happy that, we're involved in this conversation. I do feel as if, more discussions like this need to happen on a regular basis. And I feel as if, I just want to encourage more conversation with sickle cell, more awareness for the condition, and also to put into light, you know there's different aspects in regards to managing sickle cell. There's the aspect of managing it at home, in hospital, workplace, being a parent to a sickle cell patient, having sickle cell and being a patient. These are conversations that are worth having in regards to bringing positive movement for the community. And I feel as if sometimes, we're often too happy talking, complaining about what's wrong with the treatment, about sickle cell. I do feel as if positive encouragement in regards to sickle cell advocates, sickle cell patients, in regards to can we do to forward the movement for our own benefit. And I feel that these are conversations that we're not having enough. I understand that we have a right to complain, but I do feel as if, we also need to talk about the positives, how exchange information about how we manage the condition, what works for us, what doesn't work for us, what works for our children, what doesn't work for our children, the positive aspects about what we're doing to further the movement. That's why, when I was invited, to be part of this panel, I was like, I jumped to it to say, what, this is positive. We're having a conversation about sickle cell, and I do believe as if if you're willing to have more conversations, I would encourage that. I want to be part of that, and also to bridge the gap between the UK and the US. I think we do need more, exchange of knowledge between continents, and I'm here for it. I'm happy for the fact that there's other panelists are here, and I should say just keep talking. Let's address the issue of stigma, and we can only do that by just telling our own stories, telling our own experiences. Not if not for the betterment of us, but also for the future generation of sickle cell warriors and patients coming forward.
Thank you so much. Really appreciate that. And we look forward to continuing these discussions. Raquel, I want to give you an opportunity to weigh in as we're moving to the next phase here. Raquel?
Oh, yes. I just wanted to say this was a great session, very informative. Just hearing everyone's stories. Definitely is a bigger issue, and a concern that must have more attention to it. Definitely, we speak about so many other health issues, but we do not put the focus on sickle cells. And sickle cell is definitely affecting our communities, um, whether we know it or not. That's probably the biggest problem of it all, is that most people don't know it. They don't know that they do have sickle cell, and we have to just, make people aware of it. And we have to be very vigilant of getting the communities involved all around the globe, in terms of sickle cell, so that it can get more attention, more funding. Um, like the young lady said earlier, is that, even if these trials are offered, how helpful will it be if it's so difficult for them to get to the trials? So it has to be, where it can be provided to people, where it's not a hindrance for them, because it makes it so difficult that even if they start the trial, they may not even finish the trial. So it has to be feasible for the patients, the subjects, to come in to be part of the trial, and go through the length of trials, but also do the necessary research, so that because it has to be something where we can treat sickle cell, where you don't have to get cancer because we're treating one situation, now we're going to create another one. It should not have to be that way. So we just need more funding. I just spoke with someone today about some funding about another program, um, right before I got on this call. So it's definitely money out here. We just got to figure out how to get it, how to get the funders, people involved, because that's what it's all about. You need funders. You need people to listen to the cause and make sure that there is a need, and get that funding so that we can do more for this area, because it's definitely an area that we need to fix. Thank you.
Absolutely. And thank you, Raquel. And I'll just, say again that when you do have, players paying attention to the area, and like the study that is currently pinned to the top, it's, this is an important body of work to look at the various treatments and how patients are faring. And if you've got an organization that's, we do have researchers in some cases with funding, and they're struggling to get patients to participate. In this particular case, there's no therapy per se, but it's really looking at the landscape and how people are faring on these different therapies and the inconvenience of that. So just something to note, because I fully agree. This needs a lot more attention, needs a lot more research. And when there is, in fact, a focus from major organizations, we also want to make sure that they can get the study filled so that they can take next steps and proceed. So just putting that out there. All right, Lupe, would love to get your thoughts here as we are closing out. You're just what you're leaving with, what you think is critical for us as we think about future conversations. The mic is yours.
Hey everyone. It's been a good conversation thus far. I guess for us, to leave with, I think it's just critical for us to continue having these conversations. It may seem like it's not a big deal, but these conversations go a long way. And even people that may have never heard of sickle cell that came in this room today, or that weren't completely educated or aware of the things going on in the sickle cell community, they now have that knowledge, and they can pass that on, or they can do further research on their own to learn more. And it pretty much sets like this domino effect. So I think the more each of us do our individual parts and try to come together as much as we can, it'll help the community and make a difference. And I'm very hopeful that things will change from what I've seen in my 30 years of living.
Thank you so much for that, Lupe. I really appreciate that. Brenda, I'd love to turn the mic over to you for your closing thoughts.
Yes, thank you. I am so happy that I was a part of this conversation, and this conversation was held, and this is what we need. Um, and I think even those who may have listened and took part realize how complex sickle cell disease is, how it impacts the entire life of the patient as well as the family, and how important. And we go back to, what I think several of us mentioned, the core needs at this time, how the education piece, even by having these types of conversations, we're learning, we're sharing, we're spreading awareness. And the more people that know, it can roll over to more funding, it can roll over to more, which can increase more research and other studies around sickle cell disease. So yeah, I agree with everybody else who've given their closing remarks, that the conversations such as this this one should continue, and I too am encouraged. Thank you.
Thank you so much, Brenda. And Eric, I'd like to give you an opportunity to weigh in here as well. The mic is yours.
Thank you. Yeah. So I guess the moral of the story is disease is complicated. Make sure you champion for yourself, but oftentimes it's difficult to do it alone. And having your family be part of that process, or even a friend, um, help you navigate that. Of course, there are ups and downs. So make sure you have a support system, because if there are impediments, and most assuredly there will be, you want to be able to be resilient. Life is all about being resilient. Life on our planet is defined by its ability to overcome obstacles. So try to keep that in mind, and be strong while you search for the care or treatment that you need or deserve. Thanks.
I appreciate that. And as we think about the next conversation and also the broad theme of, sickle cell in the context of health equity, would really just like to request that the panel and anybody in the audience that has ideas about topics for the discussion. Obviously, we sort of skated at the surface of, kind of the big issues in the sphere, but, recognizing there's many different facets, some of which you guys raised in these remarks. Would love to request that, you could add to the chat now, if you'd like, perspectives of what should be discussed in our next meeting. Also, if there are other panelists, other participants, I know that there were maybe 4 or 5 other people that were hoping to be with us tonight, that for one reason or another were not able to be with us, including one who was stuck at a hospital unexpectedly. So I know that there's many different facets, many different organizations, patient advocates working in this area. We're trying to hold a big tent for the advancement of this conversation in the context of health equity. And we see, and others have certainly posited that, really if we solve sickle cell, we would be well on our way to solving health equity. So recognizing that as a focal point, but then all the different components underneath, really want to make sure that we hold the space in a way that does advance this, not just a dialogue, but also gets things moving, recognizing everybody's doing their part in different corridors, but there's power in coming together and, encouraging one another. I think to the point that Eric mentioned resilience and others have mentioned here. So just want to encourage back channel communication. Oh, I see we got Rose at the stage. Rose, I'm sorry I didn't see you, but I'm happy to have you add your comments or question or anything that you'd like to say. The mic is yours.
Oh no, please continue. I'm just grateful. I just want to say I'm really grateful that you're talking about this. Please continue.
Oh, yeah, we're delighted to have you. And by all means, appreciate that. Okay, so any final parting remarks before I kick it over to Spencer to give our closeout? Okay, well, thanks all. Spencer, I'm turning the mic over to you. Really appreciate everybody participating and look forward to the future. Spencer.
Hey everyone. In closing again, I'm Spencer Gurley, ambassador at Consuli and host for this room. As we wrap, just a couple of announcements. In addition to this room, we also host a long COVID room, data dignity, as well as clinical trials room. You can find all that in our club, Consuli Conversations. We also have a website, consuli.net. For direct questions, comments, feedback, you can find my email in my profile or find me on LinkedIn. Would love to hear from you about future rooms and general conversations that need to happen in this space. Be sure to follow all of our moderators, panelists, and co-hosts here today. We're looking to host this room weekly, so we're hoping to kind of build up a community and get the necessary dialogue that needs to happen. For those that joined during our event and missed the opening announcements and don't yet know about Consuli, broadly, Consuli is a public benefit company with the mission to enable individuals to participate in the data economy. We do this by operating a marketplace for our members where we become their agent and assemble patients' health records, labs, prescriptions, quality of life surveys, etc. Importantly, members receive Smart Match individualized offers from us for opportunities, including to participate in clinical trials and data trials. If audience members want to participate in long COVID clinical trials or this room, you can sign up to be matched at a study at consuli.net. There's no cost to join our movement. Pinned at the top is an important research study for sickle cell patients. Consuli is pleased to share it and teamed up with Sanguine Biosciences and Pfizer to support an important research study for patients living with sickle cell disease. If you or a loved one has been diagnosed with sickle cell disease, are over 18 and live in the US, and you qualify, you can help contribute directly to sickle cell disease research from home and be paid up to $1,300 US. We greatly look forward to our next Clubhouse discussion next week. I'm going to leave some music on in the background and kind of leave this room open in case people want to peruse other people's profiles, follow people, add to the chat, etc. But until then, we'll see you all next week.